This is One-on-One. I want to introduce you to one of the leading healthcare experts and executives in the state. He's Bob Garrett, President and Chief Executive Officer, Hackensack University Medical Center. Good to see you, Bob.
Hi, Steve. How are you?
Good. I should also disclose right out of the box, I've done some coaching up at Hackensack and it's around some very challenging communication issues.
You've done a great job.
Well, thank you. But I'll tell you what, one of the things that I know about Hackensack is a lot of development going on, a lot of changes in the healthcare landscape, beyond the fact that something's happening in 2014, you may have heard. Some national healthcare reform we'll talk about in a second. But let's go through some of the developments. I know that Pascack Valley, big deal going on there. Let's go through that. Let's go through the Mountainside Initiative, North Shore out on Long Island. Lots of connections. Let's do Pascack first.
Yeah, so Hackensack University Medical Center has really embarked on a strategy of developing a network to really prepare for the healthcare reform environment that we're in. And we believe it will be better in terms of coordination of care, expanding our quality network to regions that need our types of services and programs. So Pascack's a good example. We filed a certificate of need, which was recently approved to open up 120
by the state.
By the state Department of Health in New Jersey, and the idea is to open up a full-service community hospital, which will be 128 beds, all private patient rooms. There'll be 5 operating rooms, cardiac catheterization lab, brand new emergency department, as well as outpatient, ambulatory services and wellness services. So it will be a full-service hospital. There was a hospital that existed there since the 1950s. It closed about 4 years ago, and it went bankrupt, not because of lack of need, but really because of some poor management decisions that were made at the time. And
there's been some pushback on the part of some, particularly some competitors at the same time. And let's go right at part of that, Bob. Even though the decision's been made already, some folks, hey, listen, Hackensack's a not-for-profit. They're partnering with a for-profit. Tell everyone what the for-profit is.
The for-profit is a company called LHP out of Plano, Texas.
Right.
They run and they partner with not-for-profit hospitals to run small community hospitals.
Let's talk about that connection. The not-for-profit coming together with the for-profit. Help us understand, because devil's advocate, someone says, wait a minute, so it's got to cost more. You go.
No, I think it really brings the best of both worlds to the table. So what the for-profit partner brings to the table is access to capital, which can be reinvested into programs, services, capital equipment, and a lot of money really literally given back to the community. The not-for-profit side of the partnership brings a mission of quality healthcare, community service. So it really gives the best of both worlds. We'll be sharing governance, but Hackensack, being the not-for-profit partner, will have reserve powers because it's our name, our reputation, our quality that's on the line, and we want to make sure that the community is well served by this partnership.
Speaking of the community being served, does it change the insurance makeup, meaning who can?
It does not. Under New Jersey,
taking care of that, and who can't?
No, because under New Jersey law, the rules are the same for nonprofit and for-profit. So every patient, regardless of their ability to pay or whatever their insurance carrier happens to be, will be taken care of. And another thing that's a bit of a misnomer out there is that because this hospital will have all private rooms, that there'll be some sort of surcharge. Absolutely not true. Patients will be charged as if they were in a semi-private room.
How does that work? I mean, logically, I've got to assume it's got to cost more.
Well, it does cost more, but I think it's recognized as best practice out there now. As a matter of fact, the State Department of Health in New Jersey has recognized it as such. If you open a new hospital, meaning a hospital with a new license, you're required to build all private patient rooms because of privacy, dignity, as well as better care because less infection rates. And the whole privacy issue is very, very important. And a lot of states have adopted those type of regulations.
Help us on this. We have a big audience out in Long Island, WLIW. Make the connection with North Shore.
Yeah, so what that is two, what I believe are highly regarded quality healthcare systems in the metropolitan area that do not compete with one another, who decided to get together and form a strategic alliance to share best practices and share information with the purpose of helping each other get stronger from a quality perspective, from a research perspective, and from an educational perspective. So it's really, it's great when two hospital systems can collaborate to benefit patient care.
Okay, we'll talk about Mountainside another time because there's so many things that are changing quickly. By the way, the one larger theme here is that the hospital landscape is not going to stay the same. There will continue to be mergers, consolidations, partnerships. No doubt about it, right?
Yes, no doubt about it. I've been in the field for 30 years, and the last 2 years, I've never seen the frenzy of consolidation that's been going on.
The other thing is, I picked up the Record, which is the paper Record up in your area right now. Front page story on a wellness initiative that you're involved in. What is it? Big deal.
It is a big deal. It's going to be a 100,000 square foot wellness center, which will incorporate state-of-the-art fitness as well as wellness and preventative care type of programs. I think it's very important. It's very unique, but it's part of Hackensack's mission, because our mission is not just to take care of patients who are sick, but also we have a mission to prevent disease and to keep the community, if you will, that we serve well.
Is it a health club?
Well, it'll be, a piece of it will be a gym, but we'll have a medical component to it. But there'll also be wellness programs. So we're going to have diabetes education. We'll have mammogram services there, as well as other types of preventative care and services.
Who joins?
Anybody could join.
Open to the public?
Open to the public. It's open to our employees, to the public. It will be located right on Route 17. Will be very easily accessible by the general public.
It's interesting, as we talk about these initiatives that you're involved in, Bob, what strikes me is that 2014, obviously, going to change the landscape forever.
Right.
What does Hackensack and the expanding scope of Hackensack, what do you need to do to get ready for the Accountable Care Act being implemented? What do you really need to do?
Well, I think the best way to get ready is to collaborate and form partnerships with physicians, and that's what we have done. As a matter of fact, we're one of the first hospitals in the entire region to apply to Medicare as a demonstration project to become an accountable care organization. We filed the application in January, and we should hear any day whether we're approved. If we are approved, starting April 1st, this collaboration between 125 physicians and Hackensack University Medical Center will go into effect as an accountable care organization. So what that means is we'll be coordinating care with the goal of improving quality, getting patients more involved in their care, their families more involved in their care, and then ultimately, hopefully, providing more efficient care so that we save the system some money, save Medicare some money, and then the physicians and the hospital can also share in those savings. But the first idea is to improve the quality of care for patients.
One of your colleagues sat in that chair not too long ago, and I asked about this issue, and he said, look, Steve, not only are we not ready for this, but if it were me, I'd go back, we scrap this thing, start all over again, because it doesn't make sense. You say?
I say, you know, there's certain elements of what was passed that make sense, and I do believe whether you call it an accountable care organization or some sort of other bundled payment system with the idea of really bending that cost curve.
Watch that. Go back. Bundle payment sounds a bit jargony to me.
Okay, bundle payments mean that that Medicare as a carrier will pay all providers a fixed fee, and then those providers decide how to really reimburse each segment. So the physicians get reimbursed a certain amount, the hospitals do. If there's a nursing home in the accountable care organization, they would be reimbursed a percentage of that bundled payment. So what I'm saying is I believe that will survive no matter what happens with healthcare reform. If the Supreme Court decides to strike it down later this year, I believe some sort of bundled payment mechanism will survive, because it's very important, I think, to the federal government to control some of the costs that have been rising at just astronomical rates.
But hoping that it goes away is not a strategy.
It is not a strategy, in my opinion. It's here. It may not be in the current form that you saw that was passed 2 years ago, but it is here to stay.
Hackensack University Medical Center has a new logo. You will see it because you're one of our underwriters. But the mission is expanding as well, and we'll talk about that as it moves forward. Bob Garrett, President and Chief Executive Officer, thanks for joining us. And we should also make it clear we're taping the show right around St. Patrick's Day 2012, which explains your tie.
Thank you very much.
It does not explain mine. I'll get it right next time, Bob.
Thank you, Steve. I
Thanks.
enjoyed it.
One-on-one will continue right after this. Stay with us.
Funding for this edition of One-on-One with Steve Adubato has been provided by Johnson & Johnson, Health First New Jersey, TD Bank, the Russell Berry Foundation, and by Community Education Centers. Promotional support provided by The Record, North Jersey's trusted source, and northjersey.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.